In the last recording, I talked about control of the creation of scatter radiation. So now we're going to talk about the control of scatter after it's created. And that's primarily with a grid. You do have post-patient collimation, but primarily what we use is a grid. So grids are designed to clean up scatter after it's created, and it's only going to clean up the wide angle scatter. So the Thompson scatter radiation that might exit the patient and parallels penetration are not going to be affected so much by a grid. If it's perpendicular to the end of the grid strip, it'll certainly absorb that. Or if it's got a slight deviation and it's not completely parallel to the penetrated photons, then it might absorb that as well. But if it truly parallels penetrated photons, then that's going to make it to the image receptor. It's going to add an insignificant amount of fog and density. So what we're really after is the Compton radiation, not so much the Thompson or the classical radiation here. So unfortunately, when we use a grid, because it absorbs so much scatter radiation that would eventually create a density on the image receptor and count towards the overall S number, once we introduce a grid, it's going to absorb so much of that scatter radiation that it's going to remove so much density or density or exposure. We're going to have to increase our technique in order to compensate for that. Since KVP creates scatter radiation, and the purpose for introducing a grid is to limit scatter radiation from striking the image receptor, increases in KVP compound the scatter issue. So we don't want to increase KVP to compensate for grids. We want to increase mass. When we're talking about the effectiveness of a grid, the most significant factor that affects the effectiveness of a grid is how much lead or lead content in the grid. And that's determined by grid ratio. And the grid ratio is just that mathematical formulation where you calculate and you determine how much interspace material you have for the amount of lead that you have. So what it is the height of the lead strips divided by the distance in between them. So it's the height of the strips divided by the thickness of the interspace material. So sometimes what you have a tendency to do is want to divide the height of the strip by the thickness of the strip, and that's not your grid ratio. You're going to get it wrong. You're probably going to have some answers if you're given the height of the strip, the thickness of the strip, and the thickness of the inner space material, and you divide the height of the strip by the thickness of the strip, you're going to get the answer wrong. So it's the height of the strip divided by the distance in between the strips, which is your interspace material. So what we have with the increasing grid ratio is an increase in lead content. As grid ratio increases, what we're going to see is either a height increase in those strips, and that makes it harder for scatter radiation to get through, or the distance in between them decreases. And in both of those cases, we get, again, an increase in lead content. So what we get with more lead is more cleanup. It becomes more effective, and because it cleans up more scatter radiation, what we're going to have to do is increase our mass more in order to compensate for that increased grid ratio. So the more lead, the more effective the grid, the higher the dose is going to be to the patient to maintain our exposure to the image receptor. The Bucky factor is that amount that you have to change your mass. So it's a technical compensation for grid use. It's always a calculation of mass. So as we increase our grid ratio, we're going to have to increase our mass. If we decrease our grid ratio, we have to decrease our mass. Now, if you look at table 11-2, you can start to get an understanding of how it is that the KVP and Bucky factor change. So as KVP increases, we create more scatter radiation available to be absorbed by the grid. The grid becomes more effective with the increased KVP. So if we're looking at the most common two grid ratios that would be on here would be the 8-to-1 and the 12-to-1. At 70 kVp, your Bucky factor is 3 for an 8-to-1 grid, which means that if you go from no grid to an 8-to-1 grid, you need to increase your mass by a factor of 3. But if you are using 120 kVp, notice what happens. Your Bucky factor is 4. So that if you go from a no grid technique to a gridded technique and you're using 120 kVp, then you need to even increase your mass more than what you would at 70. So just running through a scenario, if you were shooting a chest x-ray for whatever reason at 70 kVp at 2 mass without a grid, then you introduced a grid, what you would need is 6 because the Bucky factor is 3. So it'd be 3 times the 2 mass, you'd have 6. But if you're shooting a chest x-ray at 120 at 2 without a grid and you introduced a grid, what you would need is not 100, the 2 times 3, you would need 2 times 4. So your new technique would be 120 kVp at 8 mass rather than 6. So then if you flip over to table 11-4, you see what your entrance skin exposure is at different grid ratios at different KVP levels. Notice whenever you have no grid, as you increase your KVP, your entrance skin exposure decreases. But when you introduce a grid, it increases very dramatically. So no grid technique at 70 kVp would be 0.4 milligray, and at 5-to-1 it'd be 1.4, at 8-to-1 it'd be 1.6, at 12-to-1 it'd be 2.1. So the higher ratio grid, the more dose the patient's going to see. Just a drawing of a grid, what we have is the height of the grid strip. So these would be the grid strip. That would be the thickness of the grid strip, but that'd be the height of the grid strip and the distance in between. So grid ratio is the height of the grid strip divided by the distance in between them. And it's expressed as a ratio, 8-to-1, 10-to-1, 12-to-1. We have 3 fundamental types of grids. We've got a focus grid, we've got a parallel grid, and what we call a crosshatch. And we can subdivide crosshatch into a couple of different types of crosshatch. Focused crosshatch and parallel crosshatch. We'll talk about each one individually. The simplest type of grid to manufacture and to use would be the parallel grid. And it's the simplest to manufacture because there are no calculations needed in order to determine exactly how to orient the grid strips. They're just parallel to each other. Each one is just parallel to the next. It's the easiest to use because all of the grid strips are, again, parallel to each other, so you don't have to consider things like grid radius. If the grid is placed upside down, you don't have to worry about it. It's useful, equally useful in both ways. So you can angle with the long axis of the grid strips, but you can't angle against them, and that's whether the image receptor is tilted, the grid is tilted, or if the central ray is angled. So that's really the only consideration for parallel grids, or the only precaution is to make sure that your central ray is roughly parallel to your grid strips. So you can't angle across the short axis, you can't angle with the long axis, and you can't tilt the grid. Otherwise, you're going to get grid cutoff across the entire image. The problem with parallel grids is that there is inherent grid cutoff in them, and that is because as the beam diverges, we get that angulation towards the periphery of the X-ray beam. And angulation is not specific to the long axis of the grid, but it goes across the short axis as well, which means that out in the periphery of the grid, the central ray is not going to be parallel to the grid strips. So since it's not parallel to the grid strips, you're going to have grid cutoff. In most cases, it's pretty unobservable unless you're looking really, really close. But if you are looking really close, you might actually be able to see the grid lines. So it's especially bad at low SIDs, and that is because your divergence gets greater at low SIDs. So if you can imagine trying to cover an image receptor at 72 inches with the light field, it doesn't take a whole lot. Your collimators can be fairly not closed, but they're not wide open at 72 inches in order to completely cover even a 17 by 17 image receptor. But if you drop your SID down to 20 inches, you might not be able to open your collimators enough to completely cover your image receptor. So the divergence, you're utilizing the entire divergent X-ray beam at 20, 30 inches. As opposed to 72 inches, you're just using the center of the beam. So that divergent distance at 72 inches, a divergent beam at 72 inches is pretty minimal, but at 20 inches, it's very significant. So grid cutoff in the periphery is much worse at low SID than what it is at long SID because of the divergence of the central ray. The benefits of a parallel grid is that it has an infinite grid radius, meaning you can use it at any SID. You got to keep in mind that at decreased SIDs, you're going to have grid cutoff in the periphery, but there's no reason you can't use that 20-inch SID. There's no issues with an inverted grid. If you flip it over, all the grid lines are parallel, so it works exactly the same regardless of which side is towards the tube and which side is towards the patient. So you can angle the central ray, but only longitudinally. Focus grids have to be used with a certain SID. They're complicated to make because the grid strips are canted, and that means that they lean. But they don't lean all the same amount. In the center of the grid, what you've got is parallel grid strips. So the innermost are truly parallel, but the further out they go, the more canting they get because they seek to remain at a parallel relationship with a divergent central ray. So you got a couple of different things going on there. If you can imagine this X-ray tube, if you were to bring it back, then the divergence of the central ray is not going to be parallel to the grid strips anymore. And since it's not parallel to the grid strips, the only place that you're going to have good density is right in the center where the grid strips are parallel to each other and parallel to the middle of the central ray. So if you exceed the grid radius in either direction, if you increase your SID or if you decrease your SID to the point where the divergent central ray is no longer parallel to your grid strips, then you're going to have significant grid cutoff in the periphery. So it has to be used with a specific SID. The grid strips have to parallel the divergent central ray, which means that if the divergence is too great or too minimal, meaning that your SID is too low or too long, then the strips won't parallel the divergent central ray and you'll have grid cutoff in the periphery. So it's less of a problem within that set distance than what you have with a parallel grid. You have less of a problem with grid cutoff if you're positioned properly, if you're using a set SID. So you can identify focus grids if you're working with like a tape-on grid. For portables, you can identify a focus grid because it will give you a particular focus range. And it may be quite wide. It may say like 44 inches to 80 inches or something like that. And if you exceed that focus in either direction, meaning that you have too much SID or too little SID, then what you're going to wind up with is grid cutoff on the outer edges and the periphery. Since it has to be used at a specific SID or within a specific range of SIDs, which we call the grid focus, there's less positioning latitude than what there is with parallel grids. Any kind of tilt at all is going to cause an increase in grid cutoff. So grid cutoff occurs when the central ray is angled against the grid strips, and just like on a parallel grid, that could be because the grid is tilted or the central ray is tilted against the short axis of the image receptor or against the grid strips. Or if the central ray is not centered to the center of the image receptor, then you're going to have grid cutoff. You didn't have that problem with parallel grids. Parallel grids were there was no canting of the grid strips, and on a focus grid, the only place that you've got parallel is right in the center, and anything away from the center is canted. So what you're not going to have is a parallel relationship between your divergent central ray and the grid strips if you're not centered to the middle of the grid. And it bears clarifying that what I'm talking about is that if you're using a rectangular shaped grid, if you're off-centered on the longitudinal axis of the grid, you're fine because you're still on a parallel grid in the dead center of the grid itself. But where you run into problems is if you're off-centered laterally. Longitudinally, you're fine, but laterally, you got a problem. If the grid is inverted, meaning it's upside down, then you're going to have very drastic grid cutoff on both sides. It's in the center of the image receptor, you're going to have good density. But because the grid strips here, the central ray, if we had this grid inverted or upside down, the central ray would be coming across the grid strips like that. So the only place that you would have good density is right in the middle of the grid. Straight away, you would have grid cutoff, very drastic grid cutoff in the periphery. It wouldn't even be in the periphery; it'd just be right outside of the center of the grid. A graphic of what you get with grid cutoff if you have a tilted grid, which is what some textbooks will refer to as an off-level grid, then your central ray is not going to be parallel to the grid strips. If you have off-centering off to one side, then you can kind of see how it is that you're going to have misalignment between the divergent central ray and the grid strips. If you have a off-focus grid, meaning your SID is either too long or too short and out of the focal range of the grid itself, then you're going to have grid cutoff. It's not going to be as dramatic as inverted grid, but an inverted grid is just a disaster. So crosshatch grid, the simplest crosshatch grid is made up of two parallel grids that are mounted perpendicular to each other. So you've got one set of grid strips going this way and one set of grid strips going that way. It offers the best cleanup because on a parallel grid, any scatter radiation that's running parallel to the grid strips in this dimension would get through. But with a crosshatch, they would not. So they're going to offer the best cleanup. Unfortunately, that's going to come with the highest dose. So with the best cleanup, you got the best contrast. improvement, but the patient's going to pay for it in patient dose. And then you've got less positioning latitude. You can't angle the central ray in either direction with crosshatch. With a focus grid or with a parallel grid, you can at least angle the long axis of the grid with the grid strips. You can't angle against them, but you can angle with them. With a crosshatch, you can't angle in either direction. So there's less positioning latitude even than a focused. And once in a while, you'll have a focus crosshatched, which is two focus grids stacked on top of each other, mounted perpendicular. And there is almost no positioning latitude with those. With, again, a focus grid, you could off-center on the grid with the longitudinal lines of the grid, but with a crosshatch focused, you would have to be centered directly on the middle of that grid in order to not have grid cutoff. So when we converted to CR, we ran into a problem that we'd never seen before. And you may have seen in the experimentation that where somebody has made an x-ray and then taken a picture with their cell phone. What you may have seen is some squiggly lines displayed on the x-ray or on the picture on their phone and then worked into the PowerPoint. Those squiggly lines look kind of like that. And what you have there is an artifact called a moire artifact. It's also called a lacing artifact. So these two things are exactly the same thing. And it occurs because of the similarities between the scanning pattern in a CR system, especially a CR system, but it can work with DR. If there's a similarity between the grid strips, the frequency of the grid strips, and the scanning pattern, then what you're going to see is basically a representation of the grid lines and the scan pattern. So how they combat that is to use grids of the same grid ratio, but they use a totally different grid frequency. All right, so grid ratio is the height of the grid strip divided by the distance in between them. And your grid lines and your distances in between them are not as significant as what you see here. That our grids or the grid lines are much more compact than what you're seeing here. So you're not seeing every grid line, but you're seeing some of them. So how we overcame the moire artifact and the lacing artifact is to use very high frequency grids. All right, so how we get to a point where we can have high frequency and not lose grid ratio and not lose significant cleanup because of the grid ratios is we would take the height of the grid strip and cut it in half. And then we would take the distance in between them and also cut those in half. And in that way, our grid ratio remains the same, so our cleanup is similar. It's almost identical. Your best measure of grid effectiveness is your grid ratio. Right behind that, though, is grid frequency. So what you have in a grid ratio and how you improve cleanup in a grid is that if you have grid lines that are very deep, very tall grid lines, then it makes it more difficult for scatter radiation that's not parallel with the divergent central ray to get through those little hallways that you create. So if we cut the grid in half this way, and thereby making it half as tall, then going back to the formula for grid ratio is the height of the grid strips divided by the distance in between. What we're going to do is effectively half the grid ratio, and our cleanup would go down. But if at the same time we reduce the area in between by half as well, then what we're going to have is a less thick grid. So, so the likelihood of photons making it through a less thick grid is slightly higher, but at the same time, we mash those grid strips closer together by cutting the distance in between them down. In doing that, our grid ratio is reintroduced, but again, we still have a thinner grid. Um, the grid strips come more often, so our grid frequency increases, grid frequency doubles, grid ratio remains the same. We have a thinner grid. It might not be quite as effective, but we don't wind up with this moire artifact or the lacing artifact on every image that we shoot. Most departments use an 8-to-1 or a 10-to-1 grid. Most of your portables, if you look on them, probably say 10-to-1 grid ratio, and they'll give you a focus. So it's it might be a parallel, but most of the time, most of the hospitals I've worked in, if you looked on the grid, it'll give you a set focus and the distances you should use it for. So look on your grids. I bet it says 10-to-1, and it gives you a focal distance that particular grid is for. On those also, you should see a tab that says which side should face the tube. So if you mistakenly flip the grid around, what you're going to see is significant grid cutoff in the periphery for the reasons that we talked about before. Inverted grid on a focus grid is going to give you significant grid cutoff just outside of the center of the grid. Most pediatric departments are going to use a low ratio grid to save dose on the patient. They might sacrifice a little bit of contrast. It's not going to be as effective of a grid at cleaning up scatter radiation, so you may lose a little bit of contrast, but it saves the patient dose significantly. Going back to figure 11-2 in your Bucky factor, the difference in technique between a 70 kVp, a 5-to-1 grid and a 8-to-1 grid is the technique would have to be, even at 70 kVp, 50% higher. So it's quite a difference there. The air gap technique you need not confuse with macro radiography. Macro radiography is where you have an intentional increase no ID in order to have magnification present. So macro radiography is used in special procedures, maybe cardiac cath lab, and our goal there is to have magnification. We use 72-inch SID in chest x-rays and lateral C-spines so that we reduce the magnification. All right, so what you have with macro radiography is an increase in OID without an increase in SID in order to get that magnification. It does increase penumbra, so in departments where they routinely use an increase in OID, what they'll use is an x-ray tube with what they call a micro focus. Special procedures tubes use a smaller filament size and certainly a more steep angled anode in order to have a smaller effective focal spot size. But in air gap, that's something totally different. In air gap, we have an increase in OID, but we don't want the increase magnification. So we're going to compensate with longer SID. Lateral C-spines, chest x-rays is where we use air gap technique most of the time. So the increase in SID decreases magnification, increases sharpness of recorded detail. And it, according to literature, it's supposed to take the place of a very low ratio grid, like a 2-to-1 or a 3-to-1 grid ratio. And that's because the scattered photons miss the image receptor. In that way, it increases contrast, but it only decreases density by about 10%. So what we need to do is increase our mass by about 10% per centimeters of air gap. And that's your air gap. So lateral C-spine, in this case, lateral skull. I don't know why you do a lateral skull on an air gap, but we've got a 6-inch increased no ID, and all that scatter radiation is missing the image receptor.